how do you diagnose severe dengue? What are the danger signs and what are the criteria for severe dengue? Basically, the 80% of the dengue do not have severe symptom. They are asymptomatic or they do have mild symptom. But rest 20% or 15% they do have the moderate to severe dengue. We call it dengue hemorrhagic fever. And finally, the worst one is the dengue shock syndrome. So they are of concern. How do we recognize these things? A child with fever, biphasic fever, has weak 3D pulse sort of things, and hypotension, cold clammy extremity, should have dengue test NS1, and then thereafter IgM, maybe CBC. So and the blood pressure measured. So if there is the low narrow the pulse pressure less than 20, difference between the systolic and diastolic, or there is rising hematocrit more than 20%, you have dengue clinically. And the warning sign is the fluid loss by any means, mucosal bleeding, restlessness, your hepatomegaly means systemic dengue, restless means you have CNS involvement, and you have the shock, dyspnea in dengue, and fluid accumulation in the form of ascites, in the form of pleural and pericardial effusion, and the severe organ involvement, liver, your CNS, heart, pericardial infusion, pericarditis, and so forth. So death occurs by dint of only organ failure. So these cases must be dealt in that way. How do you treat the your hemorrhagic dengue? You replace you replace the hemoglobin by blood transfusion, or if hemoglobin is not that bad, more than at least not 6, you go on giving the fluid if it is hypotensive. So fluid replacement is orally IV according to the severity status is the keystone cornerstone of management of dengue fever. You can give albumin infusion when albumin is low in capillary leak syndrome, in ascites, pleural effusion also. You can give plasma also. So, and then supportive care, secondary infection, they have to be taken care of. And now when you have organ failure, supportive cares like the liver failure, you can have a raised ALT and AST, treat symptomatic and supportive liver supporting system. Renal failure is possible, you take care of that part, the renal support, fluid electrolyte balance, and your acidosis correction, blood pressure, and finally the worst possible cases, dialysis. CNS involvement, you need supportive cares. So ultimate outcome is happy if your every point is being addressed and taken care of. So this is the way that one can prevent the dengue. Plasma infusion is also good, because it contains the colloid. So this is the way one can avoid the unnecessary death in dengue.